With 89% of Singapore's total population double-dosed against COVID-19 and 59% having also received their booster shots, are we ready to follow other countries and relax measures? Well, it's a question that's been asked many times, and it's being posed again after the World Health Organization warned this week that it's premature for any country to declare victory over COVID-19. But experts here told our senior health correspondent, Salma Khalik, that Singapore is in a strong position to further ease COVID-19 restrictions. Well, Salma joins me now with more. So, Salma, the experts you spoke with, they suggest there's a window of opportunity for Singapore to ease some COVID-19 measures given our high vaccination and booster rates. First of all, can you explain what this window of opportunity is?
Hello. Yes, when people get vaccinated, you're protected against infection for some months. And then after that, the vaccination tends to wane when it comes to your body's antibodies. So now we are talking about infection. You don't want to get infected in the first place. So people who have received their boosters, and now about 6 in 10 people in Singapore have had their boosters, started getting them in September. Experience from other countries, we find that after about 3-4 months, your antibody level starts going down. But the first 3 to 4 months, you've got very high antibody levels, which means that the chances of you getting infected is extremely low. So that's the window. And the window basically refers to your seniors, the people who are most at risk. They were the first ones to get the boosters, which was about September, October. So now it's about 3 months, 4 months by next month, I think. So this is a good period for them, for Singapore to start opening.
I see. Well, Salma, which measures then can be relaxed to fully capitalize on this period?
Right. I think we are all very tired of most measures, but none of the experts are suggesting a Freedom Day type of opening. What they want to see are step-like opening, relaxing, and to start off with the ones with the lowest risk. So Prof. Teo said the ones with the lowest risk would be outdoor activities. If you are going to the beach or having a picnic or a barbecue, you're not within an enclosed area. There's sea breeze blowing around, so the viruses are not contained within an area. So the chances of you getting infected outdoors is much lower. So that's one of the ones he suggested. Another one, and that would help the economy, are vaccinated travel lanes. Because people coming in have been vaccinated, they take a PCR test before coming in, so the chances of them bringing in an infection is fairly low. And they're tested again in Singapore, so we do catch some of them. So these, what they call low-hanging fruits, should be the first measures to be eased. And I think several of them also suggested maybe to allow more people to meet up. Right now it's 5. I guess during the Chinese New Year period, you don't want too much intermingling, but after the celebrations are over, maybe they could increase that to 8 again.
Right. Well, Salma, of course, if we do ease measures, what are the possible risks that could occur? Making sure our healthcare system can cope is always something to consider, but is that still a concern amid the Omicron wave?
I guess there's always a slight possibility that the healthcare system could be overwhelmed. But looking at how mild Omicron is, the chances are getting less and less. Right now, we've got about 16 people in ICU, whereas when Delta was raging, we had over 100 people with COVID in ICU. So there's a huge difference. And then if you look at the stats from MOH, it says that 99.6% of people get very mild or asymptomatic infections. That means that out of 1,000 people infected, only 4 get seriously ill. So with those figures, this sounds like a pretty mild disease. So when you talk about risk, there always is. If, for example, over the next 2 weeks, the whole population gets infected, 4 out of 1,000 out of a population of 5 point something, well, it's a huge number. So the whole idea is to spread this infection out over a longer period.
Well, Salma, let's bring the discussion back to the start where we talked about this window of opportunity. For how long will it stay open for, and what happens if Singapore misses this window?
Okay, the window of opportunity is not absolute dates. It depends very much on when your vulnerable seniors started getting their boosters. So this would vary. Some would have done it in September, some October, some may have waited till November. So there is a bit of a spread over time. But if we wait too long and then say if we decide to open up in April or May, then probably the antibody levels in these seniors who had early boosters would have gone down. And we might have to go the way Israel did, which is to give vulnerable people a second booster shot. But I don't know, how many of us really want to go for a jab every few months?
Right, Salma Khalik there, the Straits Times' senior health correspondent. You can read Salma's analysis at straitstimes.com and find out more on where the experts stand on whether Singapore is ready to relax measures and open up.